Well, if you've been following the conversation around the world concerning vaccines, then you will have come across talks about vaccines expiring. In fact, we've seen some countries destroying expired vaccines, ironically at a time when vaccines are in short supply. So let's talk about the science behind all of this. And Dr. Peter Emoisi, a research fellow at the University of Aberdeen, specializing in molecular science, joins us on the program. It's good to have you, Dr. Peter. Now, clearly we know that vaccines really expire, but for those who are probably planning to get their first jab or those waiting to get their second jab, and they hear this talk about vaccines expiring in July, June, especially for Nigeria, there are a lot of questions. So let's try to answer them. First, what might happen if a person gets an expired vaccine, for example? Let's begin with that.
Thank you for having me, Kayode. Basically, when it comes to expiration of drugs, it's not a peculiar situation when it comes to COVID-19 vaccines. Like you know already, all drugs or most products you have in the market, they have expiration dates. Now, when you have a drug that is expired, let's say in this regard, COVID-19 vaccine, each of these vaccine has a shelf life of 6 months to start with. So after that particular expiration date, you are meant to discard those particular products because the component for which these particular products are made are kind of time-based. So once that particular time of preservation elapsed, then it's no longer effective. And when it comes to the COVID-19 vaccine, it will not be efficacious when it comes to achieving the end goal, which is trying to trigger off the immune system in the individual body.
So it appears as though that's what a lot of countries are looking at. That's why they're destroying it. But for those waiting to get their second jabs, and I mean, seeing what's happening in India, for example, there are a lot of countries that are not sure where they will get their next batch from, because India is, of course, as you'll expect, keeping those vaccines closer to home. So in the eventuality, maybe not, that a person misses the window to get a second jab of the AstraZeneca vaccine, for example, what is the implication of that?
The implication of getting a first dose and not the second dose is just that you're going to have a reasonable level of immune protection. And that particular level of immunity, I think for the Oxford AstraZeneca is somewhere around 50-something%. So if you miss the first dose, it means that you do not really have the full cover, but you do have a reasonable level of immunity going forward. But when you go through the route of the clinical trial phase, which was done by the Oxford AstraZeneca, you are meant to give the first dose and the second dose. And based on that, you have the covering of about 76% efficacy. So that's the reason why you need to go for the first and second dose. And basically, I think when it comes to countries where you have low number of doses, clearly what you should do, for instance, in Nigeria, I'm aware that we have about 4 million doses basically. So really what you need to do is to preserve the 2 million doses to be sure that once the second dose phase kickstarts, you have the right vaccine right there for you to administer to your population. Rather than administering 4 million doses, then you're not so sure where to get the next batch of doses when it comes to Oxford AstraZeneca. Because India, where we get the COVID from, is currently in a mess right now.
Well, I think that's clearly the plan the MPHCDA is adopting, because just so far we've vaccinated 1.23 million with the first jab, and that's about 61% of those intended to get that. So I believe the plan is to have the other at least 2 million to get the second jab. But let's talk about antimicrobial resistance, because that's something that has also come up in this conversation about I mean, the virus shape-shifting, what happens in the future. And people are asking, so once they get the first and second jab, what are the possibilities in the future? Will there be a need to maybe get further? Because I know the WHO has been speaking on this. The NCDC had a meeting as well over the past couple of days. So in terms of antimicrobial resistance of the virus, what do we know so far?
So this is a virus, so I won't regard it as antimicrobial resistance. So the issue here we are not so sure of is that once you have, let's say you have the first and second dose, basically, if you draw inference from the previous coronaviruses we know, usually when it comes to the level of antibody immunity you have, it kind of wins out within 6 to 12 months. And recently there are publications already here in the UK where Imperial College did a study recently where they show that for the ones that you get, that is the natural immunity, is somewhere around 6 months. So basically, we're not so sure how long this particular immunity we get from the vaccine is going to last for, because coronaviruses behave the same. So what we need to do is we need to keep a tab on the people we are vaccinating. And that is where I have a slight issue with what is going on in Nigeria. So we've vaccinated for the last 5 weeks. So what I should expect the NCDC to do, or the National Primary Healthcare Development Agency to go ahead to do, is to track the individuals that they've vaccinated already, take their blood sample, and see if these individuals are actually generating the antibody you're looking for. And once you do that, you track these individuals for a period of 6 months to see the level of antibody efficacy they have, because we know that this particular immunity may likely wane out. So you need to be sure, first, are your people generating the right immunity you're looking for? That is the first question you need to ask yourself. Second, how long will this immunity last for within our own given population? When you look at the pandemic, clearly, you know that the way this pandemic has behaved, it has behaved differently across board. You know that when it comes to Nigeria, we're not really adhering to the non-pharmaceutical interventions. And based on that, you can still see that the cases are actually dropping on a daily basis. I know that may be tied to the number of testing we're doing. But once you infuse this arm of research into your vaccination program, you can be able to tell if your individuals are actually generating the antibodies you're looking for, then how long this particular antibodies will last for. Now, when it comes to resistance, where you have issue with resistance is, for instance, the Johnson & Johnson is developed using adenovirus 26. And that same platform is used for the Ebola virus, Ebola vaccine you have, I think, in Democratic Republic of Congo. So the only issue you have from a point of molecular biology is that if you have, so for adeno26 virus, which is the weakened virus, so used to develop, deploy the vaccine, it's common among humans. It's a human kind of virus, flu virus. So if you then bring in this current COVID-19 vaccine, there may be likely cross-reaction, because the body already knows that the body has immunity already against this sort of viruses. So when you bring in the adeno26, there may be cross-reaction there. Now, when it comes to the AstraZeneca, this is more like chimpanzee and it's weakened virus. And basically, you're only using it for just 2 phases. So the only problem is if in the 3rd phase, where you're trying to do the booster dose, we're not so sure yet if that's going to create a cross-reaction, because your body is already aware of this weakened virus. Right. Whereas after a few lengths of time, if you introduce a new product into the system again, there may be a cross-reaction here and there. That's just the science, which is still ongoing. Well,
Dr. Peter Imoisi, always a pleasure to speak with you on this topic.
Thank you for having me on your program.